A lot of you have written into me, a lot of parents, a lot of young teenagers and young adults about the use of creatine. So I think today I want to go in depth into the subject of creatine in the most simplest way so we can understand, number one, what is it? Number two, why do we need it? Number three, are there any health benefits of having creatine, either from food or from the supplement? Number four, who should have it and who shouldn't have it? Number five, what are some of the medical tests that we can do if we're starting off with our first dosage of creatine, or we're going to increase our creatine in our diet? So creatine is a naturally occurring compound in our cells. It helps us make ATP, adenosine triphosphate, which is basically the energy currency of the human body. So what creatine does is it increases our energy, especially when we're doing high interval training, but it also has other benefits: protein synthesis, muscle growth as well, because our cells in the muscle start to retain water. It also helps you with the recovery of muscles, and it also helps you with the preservation of muscle, especially in age groups when our muscle starts to decline. It is also great for cognitive health. These are some of the benefits. Let's break it down now and go age by, group by group. Sorry, I have a little scratchy throat right now. I'm in Mumbai city and we don't have the best air. In fact, today our AQI is not even in red. It's like serious, which means it's actually not fit for human beings to breathe right now. But it is what it is. The research shows us that it's safe. It's usually safe for people who are 18 years and above. So should we be giving it to someone who's 15 and 16? There is absolutely no solid evidence and research supporting that. So unless a lot of parents say, Luke, my 15-year-old, my 16-year-old wants to take it, and a lot of parents are giving it to them, well, that's your risk. We don't know what the science is going to show us as more and more people take it. You see, there are a lot of data pools for people taking it in their 50s, 60s, 40s, 30s, and even in their 20s. But the data pools for people in 15, 14, and 16 isn't enough for science yet to decide whether it's going to be good, bad, harmful, effective. So we try to stick with the research because that keeps us safe when we get into these kind of supplements that we want to take. So in the age group of 18 to 35, the use of creatine can help us enhance our strength, our performance, our stamina, endurance especially during high interval training, muscle hypertrophy, and it can improve athletic performance. Most of our athletes in India and around the world take creatine. We're going to talk about dosages, how to take it, when to take it. We'll come to that. But this is the age group of 18 to 35. It's fantastic for the people who need it. So if you're sedentary, should you be taking creatine? Absolutely not. Although for some patients, we use it very strategically. For patients who are muscle wasting, sarcopenia, certain chemotherapy patients where muscle is wasting rapidly, certain patients who are bedridden, certain patients who are in a wheelchair, you can make a very informed decision with your physiotherapist, with your medical doctor, with your sports nutritionist, with your lifestyle medicine expert, and decide if that particular patient uses it. We currently use creatine for a very select group of these kinds of patients. Otherwise, if you're building your body, you're trying to maintain your muscle, you're athletic, it's absolutely fantastic for you. So that's the age group of 18 to 35. Now let's come to the middle-aged adults from 35 to 50. Usually after the age of 30, we start to deplete muscle, men and women, we're losing it. It doesn't mean everyone loses it, which is why it's so important that we have to move away from the traditional workouts of just cardio to strength training. You're a teenager, 18 and above, you should be strength training. Even if you're 13, 14, 15, 16, you can strength train, but you're not ready for the supplement. It's post 18 based on science. All right? Now, I want to strength train to preserve muscle and to build more muscle. The more muscle I build, I'm talking about lean muscle and skeletal muscle. What we need to understand, because we don't want to just jump onto buying creatine and doing all of these things. What is skeletal mass? The density of your bones, the weight of your bones. What is lean mass? Lean mass is the weight of your organs and your skeletal muscle. What is skeletal muscle? Your muscle that connects to your bone with tendons. So your biceps, your triceps, your rhomboids, your trapezius, your glutes, your quads, your calf muscles. This is all skeletal muscle. So your lean mass or your lean muscle is the combination, the total weight of your skeletal muscle and your organs and body fluid. So when I'm saying that we need to build muscle, I'm not saying that we need to become like bodybuilders and have buff muscle. We can also just challenge and build lean muscle tone, increase our lean mass and our skeletal muscle. All right, for that, creatine will definitely help us. So in this age group of 35 to 50, creatine can actually counteract the natural decline of your muscle mass, leading to issues most commonly known as sarcopenia. So it can help us, number one, with our muscle, number two, with our muscle recovery, especially for busy people or people who constantly work out and don't make enough of time for their sleep. They don't make enough of time of recovery, although that is the right thing to do. You can't just say that, oh, I'm not going to sleep, I'm not going to recover, but I'll take more creatine. Okay, it doesn't work that way. It's also great for your cognitive health. Now, for women getting through perimenopause, when your estrogen levels start to slowly decline, your muscle mass also starts to slowly decline, which is why I tell all women, men, but specifically women, the time to start strength training is now. Not when you hit perimenopause, not when you hit your 40s. When you're 20, when you're 30, you should be building muscle. The more lean muscle you have, the more skeletal muscle you have, your perimenopause is going to be way easier for someone who has more body fat and less than the right amount of muscle. It gets worse when you hit menopause if you've not trained muscle, if you have very little muscle and you have more body fat, because your estrogen levels will now start to fall rapidly, reducing your muscle mass, and it starts to become a little bit more difficult to put on that muscle. So it's so important for us to strength train now. The younger you are, the better it is. It's like planting seeds. You want a better perimenopause and menopause. Men, you want to go with better testosterone levels and better prostate health and better muscle, which in turn protects your bones and is responsible for your bone health, men and women. The time to start is now. The little seeds that you plant when you're 13, 14, 15, 18, 20, 25, 30, 35, 40, these are the seeds that you will reap the benefits and yields of as you hit your perimenopause, as you hit your menopause, and for males, as you hit your andropause or your midlife crisis, as they call it. So in this particular group, it is important for us to use creatine if we're not getting it from our food source, and especially if you're training. Now, older adults, 50 plus, the research is fantastic. Creatine can support your muscle strength, your functional mobility, and your cognitive health. I have Alzheimer's patients, dementia patients, Parkinson's patients, patients who are losing their memory slowly on small doses of creatine. It is great for cognitive health. Now, what are some of the benefits? Like we spoke about muscle growth. It increases muscle mass, which is great for us through water retention in your cells. Improved recovery. It helps us with our recovery and it helps us with our cognitive function. Research is also showing us, and by the way, creatine is one of the most widely and commonly researched supplements. That's actually a good thing for us because there is a ton of research compared to a lot of other supplements in the market. Emerging research shows us that from the cognitive angle, it just doesn't help us with our cognitive health, but it's very protective of our brain and cognitive function. Something that we constantly lose and degrade day by day because of sleep deprivation and chronic stress. So this can support us through our aging. Now, the minimum maintenance dose can be anything between 2 grams to 3 grams. Now again, what are the sources? What are the natural sources? Because a lot of you will be thinking that, Luke, do I need to take it? If you're non-vegetarian, you're lucky because you can get it from chicken, you can get it from pork, you can get it from the highest sources, red meat, beef, mutton. These are the highest sources. You'll also find it in seafood. Unfortunately for vegetarians, you will find it in small amounts in your legumes, in your lentils, and very little in some of your dairy products. So your plant-based protein sources like your legumes, your nuts and seeds, especially pumpkin seeds, especially peanuts, and some of your whole grains. But I will be honest with you. If you are trying to get these benefits because you're training well, or you are going through a difficult menopause or perimenopause or sarcopenia, you would supplement. Under professional supervision, you would supplement. I'll be honest with you. I supplement with creatine, not because I want to build a big body. I'm off that age right now where I can lose muscle. I want to protect my creatine levels, but I'm very careful about that. When I'm primarily vegetarian, I will take creatine. If I'm in the States, I'm in Dubai, I'm enjoying my red meat, my seafood, my fish, I don't take the supplement because I'm getting it through my food. But now if I'm regularly training, I will take creatine on a daily basis. So let's get straight into what the dosages would be. A minimum dose could be 3 grams. Under professional supervision, if you're trying to build your body, you're trying to add a lot more muscle and muscle recovery, you can go through creatine cycles. What does this mean? Some people start off with 10 grams a day, some people start off with 20 grams a day. So if you're 10 grams, you would take 5 in the morning, 5 in the evening. If it's 20 grams, you would take 5 in the morning, 5 midday, 5 afternoon, and 5 in the evening as well. It's good to start off with a little bit because sometimes creatine can cause problems of a little bit of bloating and loose motions and diarrhea, but it quickly passes. But it's always good to do a little bit of a test before you do that. The second most important thing about creatine is once you finish the cycle, you could do a 10-day cycle, a 20-day cycle. Your sports nutritionist or your integrative medicine expert or your doctor would tell you how much to take according to the training that you're doing. If you're just going to be on the elliptical and you're doing a cycle of creatine, doesn't make sense for you to do it. You're going to actually put a load on your kidney. The idea is you train and you take creatine. So now, when is the best time to consume it? You can consume it before a workout, during a workout, but I like to do it after a workout because research shows that our muscles are more receptive to absorption of creatine post a workout. Now, there are some disclaimers with this. Nothing comes so easy in life. Many people have messed up their kidneys. Many people have messed up their hair growth. They get patches of hair fall, a lot of hair fall happening, bald spots appearing when they do creatine. But this is not the creatine that's causing it. We need to be smart when we're using supplements. So if you are a first-time user of creatine, number one, if you're a kidney patient, you have to keep your doctor in the loop, period. That's it. Not your nutritionist, not your yoga teacher, not your personal trainer, but your doctor. It's extremely important because creatine, like I said, is a naturally occurring compound. If our kidneys are unable to flush it out, it accumulates, creating more health problems. So whether you have a protein problem, an albumin problem, whatever it is, your medical doctor decides if you should take creatine or you should not. The second thing, maybe you think you don't have a kidney problem, and this is where a lot of teenagers and young adults go wrong. Many of us don't know that we have a kidney problem sometimes, and that's why it's the first time I took creatine, I did my KFT, my kidney function test, and I did my liver function test to make sure that my kidney is working the right way. I did my EGFR to make sure that my kidney is filtering everything out the right way. Only then did I start creatine. So to all the parents who constantly ask and their teenagers are going to start it, first get their KFT, which is their kidney function test, and their liver function test done. No, a lot of people have kidney problems and they don't know until it expresses itself. You don't want to be the person with a kidney problem taking creatine and then finding out the hard way. So that's extremely important. That's what you need to do. Now, the next thing that we have, I made another point to talk about. Yep. Individuals with pre-existing kidney disease, it's a no-brainer that you don't take it. Again, if you're a meat eater or you're a carnivore, you do not need creatine supplements unless you're cycling, because that's going to become too much of you. Does creatine powder, let's break a myth, cause kidney disease? Yes, if you already have a pre-existing condition of high creatine levels and creatinine levels, and you already have an issue with your filter, which is your kidney. All right. Pregnant women and nursing mothers should not be on creatine. And the next thing, check with your doctor. Some people are on heavy medications, and if you are on a list of medications, you want to tell your doctor or keep your doctor in the loop that, hey, I am starting creatine supplements, so your doctor can say yes or no. What is the best form of creatine? Creatine monohydrate. There are many in the market, but monohydrate is the best bioavailable, simple, good quality monohydrate, and that should be the supplement that you take. We spoke about pre-workout, post-workout, that's completely up to you. A minimum after a cycle would be maintaining at 3 grams or 5 grams, depending on your athletic performance, your current muscle mass, and everything else. So this is to answer some questions. Do we need to take it? No, you don't have to take it if you have a great diet, if you're vegan, if you're vegetarian, and you're struggling with muscle, you're wasting muscle, you're a patient that's wasting muscle, creatine comes in handy. So it's absolutely an informed decision that you do. It's something that you decide that I want to do this, I'm athletic, I'm increasing my performance, I'm at a high interval training, and if you use it the right way, it's great. Now, some people have problems with their sex hormones, DHT, and that's why I also advise people who already have hair problems, first get your hormonal profile done. If you have problems with your DHT and your DHEA, creatine can actually block this, which causes more hair fall. So is it right to say that creatine causes hair fall? It doesn't, but it can cause or aggravate hair fall in people who already have a hormonal imbalance. So it's so important to keep your gynecologist, your doctor, your dermatologist in the loop, especially if you already have a hair fall problem. If you have an alopecia, your doctor will ask you to get a DHEA test done. If you're already on DHT blockers, creatine may not be the best thing for you. So it's a myth that creatine can cause kidney disease. It can if you already have a bad kidney, if you have silent high blood pressure that you haven't treated for years and it's slowly damaging the nephrons in your kidney, and of course if you're overusing it, because a lot of people start to overuse it. When you cycle with creatine, within 7 to 9 to 10 days, you're going to feel fuller. You're going to feel muscular. Your workouts are going to be, if you're doing 10 push-ups, you'll probably do 20 push-ups. So people get out of control and they mindlessly increase creatine thinking they're going to get more results or better results. And that's when we misuse anything in life, it can now become our poison. If creatine created hair fall problems, everyone consuming it would have hair fall problems. If it created kidney disease, everyone consuming it would have kidney disease. So always be educated and not influenced by what you see. Understand the science, make informed decisions, and do it the right way. So this is all about creatine. I'll just quickly go through the comments. And I don't recommend creatine for chronic pain. They're two completely different things. Chronic pain, you need to get to the root cause of your problem. Is it inflammatory in nature? Is it caused because of a muscle tear? Is it caused because of so many issues? But creatine has nothing to do with pain. So I hope that answers your question. Thank you, everyone. I hope you will make informed decisions after this video. And if you have any questions, you can post it right here. Have a good night, everyone.